everyone. So in this video, we are going to see about the anatomy of larynx. Now, before moving to that, what is larynx? It is the voice box. Okay, it helps in phonation or production of voice. It also helps in various other functions, which is respiration. Okay, it is part of the upper respiratory tract. Deglutition, it has to close properly for us to not get aspirated. Whatever we swallow, the food and liquid should enter into the esophagus. Okay, so it aids in deglutition. It also protects the lower respiratory airways. Okay, so these are the major functions of larynx. At what level is the larynx present? You can see the larynx is present corresponding to C3 vertebra to C6 vertebra. So it is present corresponding to vertebral level C3 to 6. The cervical vertebra 3rd to the 6th one. And you can see a surface projection which is more prominent in males. Okay, that is the Adam's apple in the midline of the neck. That is the Adam's apple that is formed because of a cartilage in larynx called as the thyroid cartilage. We'll see more about it. Now, first we look at what are all the cartilage that is present in the larynx. They can be divided into two groups, okay, paired and the unpaired cartilages. The three unpaired cartilages are thyroid cartilage, cricoid cartilage and epiglottis. Okay, so these are one each in number. Thyroid, cricoid and epiglottis. And what are the paired cartilages? Arytenoid, corniculate and cuneiform. Okay, the paired cartilages, one is present on either side. They are arytenoid, corniculate and cuneiform. Now, the cartilages, generally they are of three types. Okay, what are the three types of cartilages? Hyaline, elastic and fibrocartilages. Okay, based on what are the composition that is present within the cartilage, it can be of three types. Now, in this, thyroid cartilage, cricoid cartilage and lower half of the arytenoid. Okay, remember thyroid, cricoid and lower half of the arytenoid are all hyaline type of cartilages. All the others, that is the upper half of arytenoid, corniculate, cuneiform as well as the epiglottis. All of these are elastic type of cartilages. Okay, all these are elastic type of cartilages. So you have to remember that the thyroid, cricoid and lower half of arytenoid is hyaline cartilage. The rest of it in larynx is elastic type of cartilage. We'll see about the cartilages one by one. Now before moving into that, let's get oriented to the various views in the diagram. Okay, the first one is view from the anterior. Okay, looking at how the larynx looks from the anterior. The second one is when it is viewed from the posterior. This view is how it will look when it is viewed from the posterior. The third one is a lateral view of the larynx. The fourth one is what happens, how does it look when it is cut in the mid-sagittal section. Okay, in the midline. How it is cut, that is the view. Okay, so these are the various views. And the last view that we are seeing is the superior view, viewed from above. Okay, we have to orient in all these views so that you can understand about the architecture of larynx appropriately. What is the bone that is present here? This is the hyoid bone. Okay, that is the bone that is present in the neck, the hyoid bone. The next cartilage that you are seeing here is the thyroid cartilage. Okay, so that is the thyroid cartilage. When viewed from anterior, you can see that it is having two lines here. That is how you are saying that is the anterior view. These lines are called as the oblique lines. Now, let's look at the parts. It is open posteriorly. Okay, it is shield-like. That is why it is called as thyroid cartilage. It is open posteriorly. You can see that it is not continuous. It is open. Whereas anteriorly, it is angulated. It forms an angle here. Okay, this is the anterior aspect and posterior aspect. Anteriorly, it is angulated and posteriorly, it is open. Now, it consists of two laminas. Okay, two sheath or laminas that are fused in the midline anteriorly. The two lamina each is quadrangular in shape, which has four borders and two surfaces. Now let's orient to the four borders. Okay, so these are the two laminas, 1 and 2. You can see here also there are two laminas. First, the superior border. This is the superior border of thyroid cartilage, right? That gives attachment to a membrane here called as the thyrohyoid membrane. Remember, this membrane attaches to the superior border of hyoid bone till the superior border of thyroid cartilage. That is called as the thyrohyoid membrane. This has two foramen on either side. That gives passage to the internal laryngeal nerve, superior laryngeal artery and vein. So what are all the structures piercing the thyrohyoid membrane? Internal laryngeal nerve and superior laryngeal artery and vein. So these are all the structures that are piercing the thyrohyoid membrane. It is related to the superior border of thyroid cartilage. This is the inferior border of thyroid cartilage. It is related to another membrane that is called as the cricothyroid membrane. Okay, cricothyroid membrane, because it is suspended between the cricoid and thyroid cartilage. It is cricothyroid membrane. In the middle, this cricothyroid membrane is thickened, okay, to form conus elasticus. This part of the membrane is called as the conus elasticus. So that's about the superior and inferior border of thyroid cartilage. Next, this is the anterior border of thyroid cartilage. What has happened? It has fused. Okay, it has fused with the lamina of the opposite side. You can see this is the anterior border of thyroid cartilage. This is the reason why the Adam's apple is present. Okay, in males, the angle is 90 degree. Okay, between the fusion, the angle is 90 degree. That is why it is much more prominent. Whereas in females, it is obtuse. So it is not much prominent. That's why Adam's apple is more of a masculine feature. Okay, here you can see a notch. This is called as the thyroid notch. So the angle at the thyroid notch in the superior border in the midline is responsible for the Adam's apple. So this is about the anterior border. What about the posterior border? We've already read in pharynx. Pharynx consists of two types of muscles, circular and longitudinal muscles, right? So the longitudinal muscles of pharynx will get inserted into the posterior border of thyroid cartilage. What are all the longitudinal muscles? Palatopharyngeus, salpingopharyngeus and stylopharyngeus. Okay. Palatopharyngeus coming from the soft palate, salpingopharyngeus coming from the eustachian tube and stylopharyngeus from the styloid process. All these three will form a common tendon that will get inserted into the posterior border of thyroid cartilage. You can see like this. Okay, these are the longitudinal muscles of pharynx. Then there are also two horns related to the posterior border. This is the superior horn and this is the inferior horn. What is the fate of each horn? The superior horn will give attachment to a ligament that is called as lateral thyrohyoid ligament. Okay. In the midline also it is thickened. That is where the thyroid notch is. Okay, that is the median thyrohyoid ligament. Related to the superior horn, it is lateral thyrohyoid ligament. What about the inferior horn? Inferior horn articulates with the cricoid cartilage. We'll see about it. Now, let's take a look at the outer surface. Okay, so this is the outer surface. When viewed from the anterior, whatever you're seeing now, the oblique line is there. That is the outer surface of thyroid cartilage. In the outer surface, we have the oblique line. Related to the oblique line, there are three muscles attached from above downwards. We have already looked at what the three muscles are. They are thyrohyoid, okay, between the thyroid and hyoid, and sternothyroid, okay, sternothyroid, as well as the constrictor. Okay, so the pharynx consists of three constrictors, superior, middle and inferior, right? The inferior constrictor has two parts, thyropharyngeus and cricopharyngeus. So the thyropharyngeus part of the inferior constrictor, these are the three muscles. Okay, one attaches it to the hyoid bone above, one attaches to the sternum below, okay, hyoid sternum, and the other one is part of the circular muscles of pharynx. These are the three muscles that are related to the oblique line of thyroid cartilage. Next, we'll move on to the inner surface. So this was the outer surface, okay, and these are the inner surfaces. So when viewed from posterior, you can take a look at the inner surface of thyroid cartilage. Okay. Here we have three ligaments and three muscles. This is also called as the posterior surface. The outer is also called as the anterior surface. Okay, related to the posterior surface, we have three ligaments from above downwards. The unpaired one, that is called as the thyroepiglottic ligament. That is the thyroepiglottic ligament. Then we have the vocal and the vestibular ligament. So this is the vocal ligament, the red one. Here, this is the vocal ligament. This is the vestibular, and we have the thyroepiglottic ligament. Okay, this connects the thyroid and epiglottis. So these are the three ligaments that are present in the posterior surface. What are the muscles? From medial laterally. Okay, medial to lateral, it is vocalis, thyroarytenoid and thyroepiglottic muscles. Three muscles are vocalis, thyroarytenoid and thyroepiglottic muscles. So we've seen about the thyroid cartilage. We saw it had two quadrangular lamina, and we saw about the borders, superior, inferior, anterior and posterior border, as well as the two horns, greater and lesser horn, superior and inferior horn. In addition to that, we also saw about the two surfaces, anterior and posterior surfaces of thyroid cartilage. Next, we'll move on to the second cartilage. This is also a unpaired cartilage, that is the cricoid cartilage. Okay.